All right, and we are live right now, Brenda. We are live. So, welcome everybody. This is Michelle, and we are outside the Schererville office for Portillo and Crane. And here is Dr. Gardiner once again.
How are you?
Good. How are you doing?
Good.
Yay. So, we are outside the office, and you have a really fun Facebook Live plan for us today.
Yes, yeah. So we're going to take you on a tour of our Schererville office today. So come on inside. I'm going to lead you in, and I'll introduce you to someone right inside.
Awesome. I love doing these Facebook Lives like this. This is great.
All right. So we're right in here. This is Dorian. She is one of our treatment coordinators here. She's going to take you on a tour of our office.
Awesome.
So welcome to our office. I'm going to give you guys a quick tour of what's going to happen on your very first visit with our office. When you first come in, you're going to check in at this desk right here with one of our scheduling coordinators. They'll get you checked in, give you all your paperwork that you need, and we'll get you started on your journey. Come with me this way.
Yay.
Right back here is where you're going to find our clinic. We do have an open concept clinic, so that means that parents are always more than welcome to come back and sit with their kids as they're getting their braces put on or any other appointments that they have. Mm-hmm. You'll notice at each one of our stations there are computers there. Every single office is linked up together, so we can access your chart at any time at any office. You have the flexibility of going to any one of our 4 offices, whatever is going to be convenient for you. Come on with me. We do have a great view of outside. We always hear patients home, so we try to keep things calm for the patients, and the geese are out there and ducks, so something fun.
Yeah, that's a great view. I love that. That's awesome.
So again, open concept. There's privacy dividers here, but we like everything open, so doctor can kind of go where they're needed. No doors to keep anybody out, and like I said, parents are always welcome.
Awesome.
So right in this area is where our imaging specialists do their work. So you'll come in here to get your x-rays done, and then you'll have photos done as well. So that's just a quick little tour for you. Once you're all done with your images, then we're going to step into my room. This is where I work, and this is a treatment coordination room. So come on in.
Yay. Now, this would be the perfect place to ask some questions that I know, patients or potential new patients would like to ask. On a first visit, how long does that initial visit usually last?
So your first visit, you can expect to be here for about an hour. You'll start with records, and that is where we do a 3D x-ray. We also do a scan of your teeth, an intraoral scan. We do not do impressions here at our office. Everything is digital.
Okay.
After that, you'll come into the office with me, where Dr. either Crane, Dr. Gardiner, or Dr. Portillo will do an exam. And I get a question a lot about, is it going to hurt? And nothing's going to hurt at that first visit. We're just looking and asking questions.
Wonderful. And then, well, you pretty much went over everything with the tour, and that's basically what's going to happen is when they come in, they have the initial sit down with you guys, and then they do the imaging. I love the fact that there's no impressions. I'm old school. When I had my braces, had to get that gooey stuff. I love that you guys don't do that. So when you're going forward from there, do you guys map out a timeline on how long you think the patient would be in braces, what to expect moving forward?
Yeah,
things like that.
Yep. So like Dorian said, she'll read off a whole bunch of things to me that I've been looking at in the patient's mouth. So this is actually the patient chair that we would use right behind Dorian. And so I take a look at the patient. We have a whole list of things we're looking at in terms of bite and smile and all of that. And then we sit down right at this desk here, and we would go over everything with the patient. And if there's a parent here too, or whoever else is here, just to talk about your smile, your teeth, and then all the different options that we would have to help you achieve what you're looking for.
That's awesome.
Yeah, so we would go over treatment time as well as Dorian would go over fees too.
Right. Well, and I think that's hugely important because when people are making a big decision like that, you know, to a commitment of time to really work with you guys to create a beautiful smile, it's so nice to know that you guys take the time and go over everything with them and walk them through the process. Because I think initially, for someone like me who sometimes is a little nervous going into the dentist or the orthodontist, it's nice to know that you're talking with someone and that all of your questions are going to be answered at that initial visit.
Yes, absolutely. So yeah, that's really our goal, right, Dorian? Is in this first visit, we want to make sure that the patient leaves just the most informed about everything that we're looking at for them in terms of their bite. But we also want to know what their chief concern is too, so that we can, combine those together and really come up with the best individualized plan for that patient. Every patient's coming in looking for different things that they want treated, but also every patient's mouth and teeth are a little bit different, right? So we're looking at all of that put together and then discussing that with you, the patient, to see what works best for you.
Perfect. Now, I know that you not only see, children and young adults, but you see all ages for people that want to come in and really improve their smile or, need to have orthodontic work.
Right. Yeah. We talked a little bit, right, Michelle, about this last time. Yeah. So it is sometimes a common misconception that we just see kids, but no, we see a lot of adults as well too. I think I mentioned last time too, that a lot of times, the kids will get treated and then the parents will be like, wait, I never had a chance to get braces or I want Invisalign, So yeah, we see patients of all ages.
That's great. That's great. Well, Dorian, thank you so much for the tour. And Dr. Gardiner, it was so nice for you guys to walk us around. I think, honestly, I think we should do this at each office so that people can kind of see how the differences are and in the similarities between each office, because you guys have a range of choices. You're in different areas, and that's perfect for patients that are looking for orthodontic help.
Absolutely. Yeah. Sounds great.
Yeah. That's wonderful. All right, ladies, I know that it's busy. We got to get back to seeing patients. So I so appreciate your time. This is wonderful. And as always, you guys definitely reach out to them. This is an amazing team that will help you have an amazing smile and a smooth process with the whole braces.
Awesome. Well, thanks so much.
Yay.
Okay.
Thanks,
Bye.
guys.